Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. And somebody wrote in and said, but how do I do that when my child is compulsively sticking things in their mouth? And they started out by saying food, and then they identified, no, it's non-food items. And then we had a bunch of people writing in and going, Pica, my child, Pica, 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 Pica.
Yeah.
And we sort of stopped everything and said, now it's time to get professional help. 3 parents aren't going to answer your question about Pica. But here we have you, an expert in exactly this. So I wondered if you would take just a minute and talk about, and it was a wide range. There was a 3-year-old who was engaging in Pica, a 4-year-old who was engaging in Pica, and a 9-year-old who were engaging in Pica.
Yeah. Pica is not easy to deal with. And Pica, for our viewers who are not familiar, is basically ingesting non-edibles. And these vary, right? So like we've had people, children who would, for instance, scrape chalk off the wall and eat it. We have children who would take pebbles and eat those, or sand, or whatever it is. And usually what I say, pardon me?
Batteries. That's the one that scares me. We have kids eating batteries.
All kinds of stuff. And there's many aspects to Pica, and yes, it is one of those things that can be dealt with behaviorally and should be treated behaviorally, and I'll talk about that in a second. Let's not forget, though, that there are other things to pay attention to if Pica is happening. So if Pica is happening, I've actually had children who really, they had some deficiencies, like they were lacking in calcium or other things, and we found that out because they were eating chalk or whatever it was. So it's super important to have regular checkups, and I know that sometimes the checkups are traumatic for our kids, but again, that's another thing that a good ABA therapist can work with the parents on, which is kind of getting your child to go and have blood drawn or a urine sample or that sort of thing at least once a year, because it really is important to look at these types of deficiencies that are, by the way, way more common than they used to be, mainly because our food source is so bad, So that being said, like, you really, if your child is putting things in their mouth and swallowing them, by the way, is different than just putting things in your mouth. If your child is eating, literally swallowing things that are not supposed to be eaten, then you should have a test to determine, first of all, if they have any kind of biochemical deficiency, and adjust that. Behaviorally speaking, though, it's a pretty simple kind of a shaping replacement procedure. It's not a big deal. You do need people there who can handle it on an ongoing basis, because what happens a lot of times, Shannon, as you know, like when you're a parent and you're busy doing a million other things, right? And you're trying to deal with or trying to teach something to your child. You and I have talked about this often. It isn't possible, because you're halfway doing something else and you're not able to deal with it, and you might miss an opportunity, right? So, and then the whole thing fails because you miss the opportunity, you get upset, then the child thinks it's a failure. It just becomes a mess. And it's very helpful if you're dealing with it, get help so that you have 2 or 3 people, or if you can get someone who has some expertise in behavior analysis, like a board certified behavior analyst or a registered behavior technician. This is not a very complex situation, but it does require a lot of attention, let's put it that way. And so what you do is you essentially will you will, first of all, do everything you can in the environment. So you'll make sure that the child does not have exposure to those items that they tend to eat, unless there's someone with them, right? So you want to make sure that the antecedents or the environment is set up in a way that helps the child avoid this situation to begin with. But you want to actually experimentally teach the child that when, let's say it's pebbles, right? You want to make sure that the child, when they are in the presence of pebbles, doesn't eat the pebble. So you will, first of all, make sure that you're there, or the therapist is there, the pebble is there. If the child starts to go for the pebble, you prevent it, you block it, you help the child learn to do other types of activities with the pebble, but it cannot be put in the mouth. It's just a replacement behavior, right? If every time the child, you need to be careful and you need to watch the child, because as much as possible, you want to be able to prevent it so that you can reward the child. If you don't prevent it and the child actually does put the pebble in their mouth and swallow it, now it's kind of like after the fact. And now we've kind of missed the opportunity to give the child a reward, right? So as much as possible, that's what you want to do. A lot of other things that are beneficial. I mean, and again, going back to whether or not the child swallowed or just puts in their mouth, putting in your mouth could very well be a sensory issue, and it's not really classified as pica. Pica has to do with actually ingesting the item. But and a lot of our kids have sensory issues, obviously. So it becomes really important to give the child a replacement sensory activity that gives them the same sense of satisfaction. So chewing gum is a great one, or maybe eating something that you can actually put in your mouth and swallow, that is not harmful, that is a food item. And so you gradually, over this kind of replacement and shaping activity over the course of time, you can now start to expose the child to more pebbles. But at the same time, perhaps next to the pebbles, they have, let's say, chewing gum. And you're teaching them, don't go for that, go for this, and this is what you're going to, and if you take this, I'm going to be all over it and reward you, and we're going to throw a party. But if you go for this, I'm not going to be very happy with it. And then you gradually make the environment so that sort of, now go outside and let the child see the pebbles and gradually get to the point where you can generalize it to the normal environment. But it is an issue. It's a difficult thing, and I don't really recommend parents trying to deal with this on their own, because it is time consuming, and in some cases it can be very dangerous, as you said, with the batteries, for instance. Oh, you're muted.
I'm so sorry. I remember one of the first episodes of House. You remember the old show House?
I
And
love House.
Jem had just recently been diagnosed, and it was the first time that I saw a character that was a kid on the spectrum, and it was this big mystery, a house mystery, that the kid was ingesting dirt. That he kept.
I remember that.
You remember
I do
that?
remember that.
And so here's the thing that made me crazy. Eventually, by the end of the episode, that he had a chromium deficiency, and that's why he was eating dirt. But what made me crazy was that at some point during the show, they said they were interviewing the parents, and they were like, "We're very on it." Some parents, and we've done we've tried every intervention, we've done everything that there is. And this is, while they were saying this, the kid was sitting there eating this ginormous bowl of like Kraft macaroni and cheese, and it just made me furious.
Right.
I was like, well, didn't somebody explain to the prop person that eating now we could say, well, maybe it was Daya mac and cheese, right? But back then it was like there was no mac and cheese.
Let's not promote casein.
Right. Gluten and casein express, right? With some artificial colors added to it. Listen, I used to love Kraft macaroni and cheese too, but for kids on the autism spectrum, there's a better recipe for that doesn't have those things in it. And so I remember being like, don't they understand that if you did every intervention, then you would know, and drove people crazy talking about it. But the whole episode, the point of it was that the child had a chromium deficiency. And so he was seeking the chromium in the dirt in the garden. Right. And there we have it. So I love making sure that parents know, because I think a lot of times parents just get so afraid of like, oh no, is this the beginning of the end? And they don't understand that it's treatable. However, it is very scary if you sit and do nothing. Can we just drive that home? You can't do nothing. When your child is sticking things in their mouth that don't belong there and swallowing them, that is not a let's see how it works out, maybe they'll grow out of it thing at all.
No, not at all. And actually, thanks for saying that, Shannon, because the question came up because you were talking about art. And if your child has pica, perhaps this is not the time to start them on art or anything that they will actually put in their mouth. And again, maybe it is the time, because every opportunity, every situation is actually an opportunity for learning. It just has to do with whether or not you have the time, you have the resources. And if you do, if you have the ability now to help the child in terms of learning, hey, don't put these things in your mouth, great, then let's go for it and do art. And you just have yourself or an adult there to prevent any kind of pica.
Yeah. I mean, I love, there's, what is it called? The Go Noodle thing on YouTube. You can put for a 3-year-old, because this was about the 3-year-old. If you put that Go Noodle program on, and they have the kids get up and dance, and it's all educational, and they have them get up and dance. It's not impossible to put something in your mouth while you're dancing, but it's infinitely harder. If you're not close to it, and if there's an adult there that's sort of blocking you from then you get your attention on the dancing, and then maybe, if it's a compulsion thing, maybe you head it off at the pass. But if it's a mineral deficiency, the minute you stop dancing, they're going to seek it out. So
yeah, if it's a mineral deficiency, it's kind of more important to deal with the deficiency, and then it'll stop. I mean, it's just that simple, right?
Yeah.
But if it isn't, if it's a behavioral thing that has occurred, then it becomes kind of important to figure out how to replace it. And what we used to do also in the old days, which is something, do you know that what is it? I forget what it's called, but you can buy it at every pharmacy or drugstore. The stuff that you put on your hands for kids who bite their hands or bite their fingers.
It's like no bite or something.
No bite or something like that for kids, and it's perfectly harmless, but it tastes kind of bitter. Yeah. So you can use something like that where it makes it a little bit more clear for the child that this pebble tastes not so good, but this other object that like a grape that looks like a pebble, it tastes actually pretty sweet, and I can have it. Honestly, sometimes it's just a habit, and breaking the habit, it won't go on forever, but you do need to do the intervention to break the habit, which is,
Yeah, and if you don't have time to go to the drugstore to get the no bite, you know what else works is aloe vera. Fresh aloe vera. If you take fresh aloe vera and put it on their fingers, within minutes, aloe vera tastes very bitter.
I didn't know that. Okay.
Same thing. Oh, it's bad. Bad news bears. It really puts you off your meal. And totally natural. There we go. All right, we got to get into some of these questions that have been written in. Did I mention that we are live on a bunch of different places? We're live right now on Facebook, on YouTube, on Twitter, and we love to hear from you guys. Even though we recorded this just a couple of hours before it's going live, we still want to hear from you guys and want you to participate. You can still write in questions. They'll just be answered in a different show. We're also available as a free podcast wherever you get your podcasts. It's a free download. Check us out. We are the #1 rated autism podcast. So, you can't isn't that wonderful? And that's all thanks to all of you. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.